Well, we've got to make sure we don't end up in our zeal to get a bill shifting costs to the middle class, the very people that we're trying to relieve. We got to find some more revenue. The only people who've gotten away with murder so far are the people who in the industry, such as the pharmaceuticals. Boy, for what they're going to get, trillions of dollars, they've given very little. So it's now a question only of revenue. Look how the public plan seems to come roaring back, for example. And I think that's because people have figured it out. Their wages have been going up, their health care has been going up at a rate 3 times their wages, which is, of course, why everybody's wages have been flat for decades now, and why people have been borrowing on their homes because they want to see an increase, of course. They're not seeing it in their wages, why they've been borrowing on their credit cards. So it's kind of all coming together for people. If anything, I said yesterday to some of my friends in the Democratic caucus, we better watch out because the public option is becoming so popular. I think more people may think they're going to get it than are supposed to get it under the bill, because of course it's for a fairly limited number of people. But I couldn't be happier with how this is turned around. We've just come from an extraordinary bipartisan session when we gave the Congressional Gold Medal to the first African American, Senator Edward Brooke, and there we had the full array, all of the Democratic and Republican leaders. The big joke was, of course, that the House and Senate together in a bipartisan fashion beat the Capitol Police in football yesterday, so everybody could clap at that. And Senator Brooke called upon everybody to once again engage in the bipartisanship of which he was such a part. Senator Ed Brooke, the first African American senator to be popularly elected, was a Republican from Massachusetts, a state that had only 2% blacks and a state that was overwhelmingly Democratic. So he couldn't have had a better messenger today. We are getting close to where I'm not worried about that. We are so close to 218, the number you need for a majority for the entire bill, including a public option. I'm less worried about that than I am about making sure that the revenue we need is covered, given the mark the president has set for us of under $1 trillion. I'm surprised to hear people early out of the box indicating some concern, and I think what may turn them around are the way the polls are going. I don't know who they think they're speaking for, but we're finding people from all over the country, especially in some of the states where people most need health care, and those are some of the states where people have been more conservative on public option. They better go home and count heads. No setback. There was some concern that some thought we were using as a possible vehicle only the defense appropriation. To the contrary, I have submitted a proposal based on 3 months of very rigorous investigation that presents leadership with a menu of possible ways to get a clean D.C. voting rights bill through. I had a very good conversation with Senator Reid today. I'll be talking to him again in person next week. So I am very pleased with how that is going. The notion about the defense appropriation just happens to be one committee that was considering it, not the range of vehicles and of approaches we've submitted.